Greetings and welcome back to this channel. This is Dr. Farida Rajan Ibrahim Omasundi, and today we are going to discuss infertility. So we are going to look at the causes, the symptoms, the diagnostic approach, the treatment. So if you haven't yet liked, please do like, share and subscribe. So what is infertility? So infertility is the inability to achieve pregnancy after 12 months or more of regular and protected sexual intercourse. So infertility can be in different types. So we can have primary infertility as well as secondary infertility. So for primary, this is where a couple has never achieved the pregnancy before. And then for secondary infertility is where the couple has previously achieved pregnancy but is now unable to conceive. So what are the etiological factors or the causes? So we are going to divide them into male factors as well as female factors. So coming to male factors, what are the causes? So we can have different causes. The first cause we'll look at is sperm abnormalities. So in terms of sperm abnormalities, this is where we can have a man having low sperm count or oligospermia. There can be no sperms at all, which we also call azoospermia. And sometimes you find that there is poor motility, or sometimes there is abnormal morphology of the sperms. So another cause can be varicocele, where there is dilated testicular veins that can impair sperm production. Sometimes there can be hormonal imbalances where there is low testosterone, and there can be high FSH or LH. Sometimes there are genetic abnormalities such as Klinefelter syndrome. And then sometimes there's obstruction to the vas deferens, or there's blockage. The man can also have infections, which can be another cause, such as STIs. Sometimes it can also be due to lifestyle, the smoking, the alcohol, or obesity, or high temperature exposure. Those can also cause infertility. Medication and toxins are other causes, for instance, in terms of chemotherapy, radiation, anabolic steroids, or environmental toxins. So what are the female factors? So for female factors, they include ovulatory dysfunction, which amounts to 25%, and there are common things such as PCOS, which is the most common cause. Thyroid dysfunction. They can also have hypothalamic amenorrhea or hyperprolactinemia. Females can also experience tubal factors, which account to 20 to 25% of infertility, where there is tubal blockage due to infections such as PID or surgery or ectopic pregnancy. And sometimes tubal factors can also include things such as endometriosis related adhesions. Coming to uterine factors, they can have fibroids, polyps, adhesions, or congenital anomalies where there is septate uterus, leading to infertility. Females can also experience cervical factors such as insufficient cervical mucus or anti-sperm antibodies, thereby leading to infertility. Age is one factor as well. Female fertility declines significantly after the age of 35. There is lifestyle and environmental factors, where there can be obesity if the woman is also smoking as a risk factor, excessive caffeine intake or alcohol, or even stress can lead to infertility. So sometimes there are combined factors where there is both partners with identifiable causes leading to infertility. So what's the diagnostic approach? So we can divide the approach into initial assessment as A, and then the B part will look at investigations. Yeah, so for A, the initial assessment, this is where you carry out a history for both partners. So for the female, you can look at the menstrual part, you can look at their sexual, how is their sexual relation, you can look at the lifestyle, are they smoking, drinking, you can also look at the medical in terms of maybe any drugs they are taking. Sometimes you can also look at the family history, is there a history of infertility on both ends. Yeah, so you come to the physical examination where you have to test, you look at the testicular size, you look at obesity or varicocele. Yeah, you have to do physical examinations. Coming to the investigations, for the female partner, you can do a hormonal profile where you look at each hormones, FSH, LH, and other hormones. You can also do a pelvic ultrasound, for baseline anatomy. You can do a transvaginal ultrasound. You can do a laparoscopy as the gold standard for diagnosing endometriosis or tubal disease. You can also do a hysteroscopy for direct visualization of the uterine cavity. Yeah, and then for the male counterparts, you can do a semen analysis where you look at the volume, the count, the motility, the morphology of the sperms. And then you can also do a hormone profiles in males where you look at the testosterone levels, LH, FSH. Yeah, you can also do a scrotal ultrasound, and you can also do genetic tests in cases where there is azoospermia or severe oligospermia. Yeah, so what are the treatment options? So for treatment options, you can look at lifestyle modifications. If there's obesity, you encourage weight loss. They should cease smoking, cease alcohol intake, need to learn how to manage their stress well, improve diet, and also encourage exercise. Yeah, so that's for lifestyle modification. You can also give medical treatments. For instance, you can give antibiotics for infections. You can do ovulation induction with different drugs. You can also do thyroid dysfunction with antithyroid drugs. Yeah, there are also surgical options available. So you can do myomectomy for fibroids, you can do tuboplasty for tubal blockades, and many other treatments. Yeah, you can also carry out assisted reproductive techniques where you can do intrauterine insemination, in vitro fertilization. Yeah, and then what are the complications? So the complications can include ovarian hyperstimulation syndrome, which is rare but a potentially life-threatening condition. There can also be multiple gestation, which is more common with ovulation induction and IVF. Yeah, so what are the prevention strategies? So for prevention strategies, you can do a comprehensive sexual and reproductive health education. Yeah, they can strive to prevent and treat STIs early, early diagnosis and management of endocrine disorders, access to family planning services, and fertility preservation, especially maybe in cancer patients. And sometimes, most of the times, they have to reduce environmental exposure to toxins. Yeah, and that's basically it on the prevention strategies and in this lecture. So I hope to see you in the next lecture. Thank you so much for listening.